Cow's milk protein allergies is one of the most common allergies in infants and can cause significant discomfort, and sometimes parents have a really hard time trying to figure out what the symptoms are and how to go about it. So that's why we have the session today. Hello and thank you for joining me. I'm Dr. Lamfruni, a pediatrician and founder of Generational Wellbeing. In today's video, we'll talk about cow's milk protein, what it is, what are the symptoms, and how you can help your little ones get over the stage that causes significant pain and discomfort in infants. Like I said in the intro, it affects up to 2 to 3% of infants. And what is this? So cow's milk protein allergy is when your immune system or the baby's immune system mistakenly take the cow's milk protein as it tags it as foreign, and then the body builds an immune response to it. And when the body builds an immune response to it, then we start having symptoms. Symptoms typically occurring between either immediately or up to 2 hours after consumption of this cow's milk protein. So for example, a baby will eat a milk bottle and then either immediately or within 2 hours they break out a rash. Hives is a very common sign of that. Some kids or babies will have eczema. You see the eczema around their cheeks and their trunk, and some kids will just be super fussy. We also see where they're just spitting up a little bit more, and sometimes they may have constipation, other times they may have diarrhea, and then there have some kids who actually have blood in their stools. So if you have an infant who is extremely fussy, they're spitting up more frequently than usual, they're having either diarrhea or constipation, or having blood in their stools, or their skin is just look at me and I break out in a rash, whether it's hives rash or just eczema where their skin is just red hot or it's just they're very reactive, it may be cow's milk protein allergy. Once we figure out we have an infant who reacts to cow's milk protein, and sometimes even with breast milk, right? Because if the mom is eating dairy products, sometimes you can have that through breast milk. So whether it's formula or it's breast milk for a mom who is eating a lot of dairy, we can still see that reaction in those infants as well. The biggest thing then with diagnosis. So if you have a baby that way, you want to talk to the baby's pediatrician to see how you can come up with a diagnosis and a treatment pathway for your infant. So usually history is really important here because the timing is what really determines it. That's why we said usually happens immediately after or even up to 2 hours after the consumption of either milk, breast milk or cow's milk based formula. Now, once we have that history part of it that is consistent with it, the thing that we usually would recommend then is switching over to a hydrolyzed formula for the kids who are on formula, either a hydrolyzed formula option, so like Alimentum or Nutrigen, or sometimes there's some kids who have to go down to an amino acid based formula options, Neocate and Elacare. Or there are a few kids who tolerate this soy based formula. However, there's some kids where they'll have that cross reaction, about 10% of kids where if they react to cow's milk, they're going to react to soy milk based formula as well. So depending on how severe the child's case is, you may have to go in now with avoidance, whereas avoiding that milk allergen, that milk protein allergen, and replacing it with a hydrolyzed formula to remove the culprit out of the infant's diet. Now for breast milk, for those kids who are infants who are exclusively breast milk fed, then that will be removing dairy from mom's diet. So the mom will now have to get on that dairy-free diet where they're avoiding all the dairy, especially the milk and cheese and all the stuff, the dairy products that are found in their food. That means that the mom now has to really read those labels because there's milk in so many things where sometimes you feel like you've eliminated almost everything from your diet and you look at something and there's milk in it. So then mom will have to eliminate the basics but also pay attention to labels to make sure that they're not consuming milk products and not unknowingly consuming milk-based products. Now, once you make the changes with the diet, then it takes up to 2 to 4 weeks to see results. Sometimes I'll have parents who will come back and say, we've made the changes, we've tried for about a week, they're not seeing any difference in the symptoms. But yes, because it takes that long for the body to completely eliminate that allergen and for you to really see any really huge change in it. So then once you're doing that, just bear in mind that it takes up to that time frame. So you want to be patient and consistent with that and give it a good try before we're making other options then. Good news about all of this is that most kids then will overcome the milk protein allergy by the time they're between 3 and 5 years old. They will overcome it where they're fine after a while. Now, if you have an infant who you started like right from birth, they had that issue and stuff, especially in that first 2-3 months of life, and we've switched over to hydrolyzed formula and they're doing really well, sometimes after 9 months to a year, you can like slowly try to reintroduce the milk protein and see how the infant reacts to it, because like we said, most kids will grow out of it. So if they're one of the kids who grow out of it, slow reintroduction, so that's starting like maybe with yogurt based products, little amounts of milk here and there, little amounts of different things like cooked with milk, and then seeing how they're tolerating it and slowly increasing it over time to see if that child has overcome that allergy and is now at a point where you can now feed your baby without being very extremely restrictive when we're doing that. So that is an option, and that's the good news about it. While it's very uncomfortable at this stage, then elimination is usually, or avoiding that allergen is usually the mainstay of therapy. Now, I talked about mostly milk protein allergies. Before I end this video, I want to talk about the difference though. Sometimes there's that confusion between a milk protein allergy and lactose intolerance. Usually the milk protein allergy affects more of the infants because there's that immune response built against the milk protein. It's the cow's milk protein itself, that's the casein and the whey protein in cow's milk. Whereas lactose intolerance is when the GI is more so in older kids. Very rarely is that seen in infants, where your GI system lacks that enzyme that breaks the sugars in milk, and then leads to GI symptoms. You see just bloating, gasiness, fussiness, but it's usually more so GI symptoms specific than other symptoms that are affected, like you would see in the cow's milk protein. If you have a child who, especially an infant who is super fussy, even either having diarrhea, bloody stools, or constipation, and it's just breaking out in eczema, it may be milk protein allergy, and you talk to your doctor about it to see what options are available to help your child become comfortable. I hope you found this video helpful. Don't forget to like, share, and subscribe, and tag a parent whose parent may be fussy and they're trying to figure out what is going on with your baby. Thank you for listening as always. Until next time, I'm Dr. Ferndi.